coming down to repeat cases or second time corona, I have friends and some dear ones, and I see them asking me the question. They're probably trying to challenge COVID. So two questions actually. One, after how many days of testing corona positive should we actually test for antibodies? And I think you mentioned, but I want you to restate it. And until when do the antibodies last?
Okay.
And the final one, for my dear friend's response to him is what is the risk of getting reinfected by the virus? And I've read about the Nevada case. I've read about Hong Kong. I've read about a few others.
So great question. So I just want to start with the role of antibodies. So just to clarify any misconceptions, antibodies are not a marker of current infection. Antibodies are a marker that you've had an infection in the past, and now your immune system has been able to activate, and the antibodies have been somewhat protective to the infection. So again, antibodies are not a way to diagnose current infection. Antibodies are a marker that you've had an infection in the past. Antibodies usually take around 7 days to start developing, and and their peak usually happens between 10 days to 14 days after an acute infection. How long they last, we don't know the data yet. There have been patients who've had antibodies up to 2 to 3 months after. There have been patients who have had antibodies, but those antibodies have gone down within a month or so. So we really don't have good data to suggest how long these antibodies will last. Antibodies should be protective, but again, we unfortunately, we still don't have data on whether the protection is you won't get a reinfection, or whether if you get a reinfection, it'll be a milder form of the infection. Learning from flu, it might be the latter, where having a vaccine doesn't quite completely prevent an infection, but prevents a secondary bad infection to happen. Much of the data surrounding how to use antibodies is still evolving. Unfortunately, we know that having an infection doesn't quite protect you against a reinfection. Like you were mentioning, the Nevada case, there have been cases in Southeast Asia as well with reinfections. And in some of these cases, the reinfection has been much more severe than the primary infection. So I would like to dispel if there is a misconception that once you've been infected, you're immune for months to come. We shouldn't be lying in that false sense of security.
And with the poll that we did, with more than half saying they know someone who was positive or they were positive, I think this is a very strong message. And without naming you, my friends, please be careful. The antibody is not going to protect you. It's not a shield. It's not a once you have, you can still get corona a second time, and clearly the second time could be more stronger. That is what the empirical data is.